Hello, 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 everybody. Welcome, welcome, welcome. Tonight, we're continuing our theme of exploring pediatric kidney disease. My friend Emily Whitacre is on the show tonight. She has a Bachelor of Arts in Psychology and is a caseworker and a social worker. More importantly, she is the mother of a 6-year-old boy, Henry. Henry is a pediatric kidney patient who had a kidney transplant at Riley's Children's Hospital on his 4th birthday. That's a heck of a birthday present, isn't it? And we're going to talk to her tonight about the ups and downs of being a pediatric kidney patient mom, and find out what's going on with her son. So please welcome Emily to the show. Hello, Emily. How are you?
Hi, Jim. I'm good. How are you?
I'm good. I'm good. Do me a favor. Tell me your name and spell your last name for us, please.
Yeah.
There's a little different spelling.
It is. It is. So thank you so much for having me on tonight. It's great to be here. Happy Thanksgiving. My name is Emily Whitacre, and it's Whitacre. So it's actually ironic and a little funny that you say that it's a different spelling, because in my town where I'm from, actually every Whitaker that I know is spelled the way that we spell it. So, but I hear that all the time, that it's like not a common spelling.
Okay, that's from Huntington, Indiana. Yes. Is that right?
Mm-hmm.
Okay.
Yep.
What is your occupation, Em?
I'm a mental health professional by trade. So social worker. I've done everything from behavioral clinician, working with kiddos. Most of the demographic that I've worked with is with child and adolescents. So behavioral skills, life skills. I'm a social worker, caseworker, case manager, all around coordinator. That's kind of where I fall. My biggest title is just a coordinator of services.
Okay. Well, I'm going to have to put my Poindexter on tonight. I got smart ladies on with me. So. Are you a married lady?
I am indeed. Yes. My husband and I have been married for about 2 years now. Kevin, we've been together for much longer than that. But we have, yes, two littles. So there's our Henry and then our sweet, I promise you she is sweet, not based on that picture. But our sweet Gertrude, our littlest there. So yeah, we've been married going on 2 years, coming up here in about 3 weeks, actually.
Oh, congratulations. Happy early anniversary and all
Thank
that.
you so much. And Jim, I got to tell you, look who stopped by to say hello.
Henry, how are you, buddy?
Nope, camera shy. Figured that would happen.
Must have been something I said.
He
Well,
is.
we're going to spend most of the night talking about Henry.
Yeah.
Tell us a little bit about Gigi.
Oh, Gigi. She is our Spitfire. She is 100% the opposite of everything that Henry ever was. So in every way that Henry was timid and shy, she is the exact opposite. She is fearless and sometimes a little reckless and dangerous. She definitely keeps us on our toes. She'll be 18 months here next week, actually. So 1.5 years. We are not quite into the terrible twos yet.
Okay, and I think I read Henry is 6.
Yes, he'll be 6.5 in 2 weeks, actually. So yeah, he's doing great.
Oh, wow. Birthday coming up soon. Let's talk about Henry. Approximately when did you discover that you were pregnant?
It was in the fall of 2013. And just kind of knew, right? When you're a woman, that's what you hear, is that you just kind of know. And so took a test, and sure enough, yep. And we were thrilled. We were really excited, super excited. And yeah, then everything went really smoothly for the first 3 months. And then we went in for a routine ultrasound, and that's kind of when things got a little scary, a little wonky.
Okay. Tell us what happened. That was an 18th week checkup, if I remember right.
Yeah, 16 and a half, actually. Yeah.
Okay.
And so it was very much like a movie, a scene from a Lifetime movie almost. We went in for a routine appointment. It was in the afternoon, the end of the day. And our nurse was so sweet. And she said, well, you know what? You're far enough along. Would you like to get in for an ultrasound to see, your little peanut? And we, of course, said yes. We weren't supposed to that day, but we thought, of course, gosh, yes, we want to. And we really thank God for that, because that is when we found the issues. So we definitely believe that was a God-driven moment, and we give thanks for that.
What kind of issues did you discover? What are we talking about?
Well, they didn't tell us much at that initial finding. It was very surreal. The technician started the ultrasound, and then she stopped and she said, I'm going to tell them not to go leave at the lab because you have to have your blood work done, which was true. But then she left and she said, and I'm also going to grab the doctor. And she grabbed the doctor. And as soon as she left the room, I told Kevin, he was with me, and I said, something's not right, because she wouldn't just start the ultrasound and then stop it and go get a doctor. So at that point in time, they told us they had found a mass basically in his stomach, is what they thought they were seeing. And so we went to a high-risk doctor here in Fort Wayne with kind of that same assumption. And he actually referred us then to Cincinnati Children's Hospital with, at that point in time, what we thought was a gastric issue. They actually thought it was a mass that had formed in his stomach. Once we got to Cincinnati, then we found out that it was not, in fact, his stomach. It was that mass that they saw was actually his bladder that had distended. And on the ultrasound picture, the mass, his bladder, was actually larger than his head. So it was immensely distended and so much larger than it should have been.
Okay. And what did you learn about that mass? What was unusual about it?
It was, well, number one, not supposed to be there because it was his bladder and it was full and it wasn't draining, which was the big issue. And so they ran every test they could run, and we switched. We started off the day talking to the gastroenterology people, and by the end of the day, we were talking to nephrologists and urologists, and I think we even had a pulmonologist in there at that point, and they said that his kidneys, they showed us pictures of his kidneys, what they looked like, and they were just full of, they looked like little starbursts on the ultrasound pictures, because they were just full of little cysts and things that weren't supposed to be there, because they were very tiny and very underdeveloped. And so what they explained was that Henry had what's called posterior urethral valves, or PUV, and it's basically this tiny, tiny flap of skin that on Henry wasn't flapping, and it was causing the urine to back up into his kidneys and essentially shutting them down. And on top of that, that bladder being distended so large was actually pushing on his diaphragm and not allowing his lungs to develop the way that they should.
Okay. I understand that. Well, let's settle this first. You're talking about going to Cincinnati. You live in Fort Wayne, don't you?
Yes, we do. We do. So when we got that original diagnosis, the high-risk doctor here in Fort Wayne said, I'm going to send you elsewhere. And my first thought was Riley. And he said, oh, no, they can't do what you need there, because they were expecting to have a certain type of surgery. And at that point in time, there were only 2 hospitals in the country that were doing that kind of work. And so it was either Cincinnati or Arizona. And we said, well, Cincinnati's within driving distance, so we're gonna vote for Cincinnati. And it was like 3 days later, I think, that we were there. Yeah.
Okay. Now I understand that while you were pregnant, you actually had a couple of surgeries to help Henry's health. Can you tell us a little bit about that?
Yeah. So the first one, it all happened so rapidly. It was actually Good Friday when we went down for the initial diagnoses and testing and all of that at Cincinnati. And they gave us all of our options. And then the following Tuesday, I actually underwent my first surgical experience, which was a laparotomy, so that they could operate on Henry. And at that point in time, the intervention that we had chosen was to basically go in and kind of make that skin flap a little bit, kind of poke through that flap that wasn't flapping and make it work the way that it was supposed to. We knew that it wouldn't undo the damage that was done, but we knew it would prevent any further damage, and that we could kind of go back then and try to treat and correct and fix the other side effect problems, I guess. So that was the first surgery, and it went really well. It was a long one, but it went well, and they were successful. And they had, at that point in time, inserted a Foley catheter basically in his bladder, so that he was voiding his bladder just continuously, because without that in pregnancy, right, in utero, that's the amniotic fluid. And when it's this process, so that they drink in the amniotic fluid, that helps their lungs develop, and then they void it out through urinating. Well, Henry wasn't able to do that. And so his kidneys were backing up, his lungs weren't developing. And so we really needed to get rid of that urine in the bladder. And so they inserted a few they kind of looked like pigtail shunts. And so the shunts were working, and then they had the Foley catheter. And about 3 weeks after that surgery, because I was being continuously monitored for amniotic fluid levels, and about 3 weeks after that, suddenly we had a skyrocket or a drop in amniotic fluid, and there wasn't any. And it had seemed that the Foley catheter had stopped working. And so we went back to Cincinnati, and they did an ultrasound, and sure enough, something had caused the catheter to dislodge from its original placement. And the only thing that we could come up with at the time was that he had reached down and pulled it out. So he was being active and finicky and stubborn and feisty, even in womb.
Already.
And yes, but that gave us a lot of hope, because we were like, okay, we know that he's a fighter, and we know that he's not just going to lay down on us. And so they inserted a couple more shunts at that point in time, and then that carried us through until delivery, which wasn't that long after. But
Great. And when was Henry born, in fact?
He was born in July, so July 18th, 2014. And his due date was in September. So he came pretty early, and I had gone into labor earlier that week. He was born on a Friday, and I had gone into labor on about Tuesday. And they kept trying to give me medications to slow it down and stop it. But then by Friday morning, it was pretty clear that he was going to make his entrance. And it was wild. There were so many people in my delivery room. I had a team for myself because I was having blood pressure issues. Henry, of course, had his own team there ready and waiting for him. We had family in the room. We had, clerical staff in the room because I had my doctor come in that morning and he said, don't get your hopes up, basically, because we don't know. We have no idea what this birth is going to bring, which we knew going in, but we just prayed. We prayed hard, and he made his entrance. And I got to hold him for about 30 seconds, and then they bundled him all up and wrapped him all up and put him in his little incubator and shipped him off to the ICU, the NICU ICU.
Okay. And this was in Cincinnati with the delivery place?
Yes. Yep. In Cincinnati. So we actually delivered at the University Hospital. And then they took him over to the Children's Hospital, which is connected.
Okay.
Yeah.
Now, I understand he was in ICU for a long period of time. How long was he there?
Very. So we were in the NICU at Cincinnati Children's Hospital for 4 months. And then once he was stable enough to be transferred, we transferred to Riley because we knew that had always been the plan, that when he was healthy enough, we would transfer somewhere close to home, that was a little bit more manageable for us. So that was at 4 months, right before Thanksgiving. So we spent our first Thanksgiving and Christmas in the NICU, and then right after the New Year, it was actually at day 179 that we got to go home from the NICU.
Okay. I understand that he was placed on dialysis almost instantly after his birth.
He
Would that be a fair statement?
He was about a month old. Yeah. So that was the first 2 to 3 weeks were crucial, because we had to keep him alive long enough to where his body was big enough to endure the dialysis, because it was pretty much 24-hour dialysis that he was on once he started. Because, they have to do it when they're that small. I mean, he was 4 pounds and 3 ounces when he was born. So when they're that small, they have to do it in such small amounts that we really had to fight and make sure that he could be stable enough and strong enough to do the dialysis. So, but he made it. He hung on, and he was like a month and a half, I think, when we finally started it. Yep. Yeah.
Okay. And I understand that initially you tried to do home dialysis. Can you talk to us about that a little bit?
Yeah. So we did the peritoneal dialysis, or PD, which is what you can do at home. And that was kind of my first dive into nursing a little bit, because, as the caregiver, I was basically responsible for hooking up that machine and making sure that it was all running smoothly. So dialysis was essentially done by me. And it involved hooking him up to a machine at night, and it would run throughout the night while he was sleeping, for anywhere from 10 to 12 hours, depending on how old he was, or how much he needed. And it was great. I mean, it wasn't without its downfalls, no medical procedure is, but it allowed us to have some freedom during the day, because while he was hooked up to his G-tube and his oxygen and all of that kind of stuff, we didn't have this big old dialysis machine that we were attached to. So we ran with peritoneal dialysis until he was a little over 2 years old. He was probably 2.5 when we started really kind of having some issues with infections in the line. And then when he had his big surgery in 2016, Dr. Goggins really felt like, if we move forward with peritoneal dialysis, we really stand a strong chance of injuring his peritoneal cavity, which is where that new kidney would need to go. So Dr. G said no more and switched us over to hemodialysis at that point.
Okay. And that would have been at Riley's Children in Indianapolis?
Yep. Yes, indeed it was. And we had our training. So in order to do, Lisa, what is it like for a baby to do dialysis? Yeah, That's just it. It's huge, and it's so complicated, and it's so involved, that it's dangerous. I remember just frankly asking our dialysis coordinator, what about DaVita dialysis? What about all these places that are seen so much closer to home? And our coordinator basically told us they would kill him because it's pediatric dialysis is so complicated and involved, and it involves so much, managing and number crunching and all of this kind of stuff that it really can be really dangerous. So, we had a wonderful coordinator. I had to do like 45 hours of training in the hospital before they would even let Henry come home to do dialysis at home. And I was the only person who was allowed to touch the machine. I had a backup person who lived outside of our home. That way, if anything ever happened, somebody else could run it. But yeah, it was pretty much a crime to let anybody else touch that dialysis machine. So I very quickly became a nurse and kind of put on my okay, I got to pay attention and make sure I'm on it all the time for this.
Okay. Now, you live in Fort Wayne, Indiana.
Mm-hmm. Yes.
Henry was taking dialysis per Dr. Goggins' instructions at Riley's Children in Indianapolis.
Mm-hmm.
I looked that up. That's about 155 miles distance one way.
Yep. Yes.
And as I understand it, you were driving Henry back and forth from home to dialysis. Can you tell us a little bit about that?
Yes. So when we were recovering from his bladder surgery, which was scary, it did not go as well as planned. But when we were recovering from that and we were kind of talking about what the future would look like with dialysis, at that point in time, we were driving down to the clinic 6 days a week. And so Monday through Saturday, I was taking him down, and we would leave about 6 o'clock in the morning and get home about 4 o'clock in the afternoon, depending on traffic, of course. And we did that. That was the longest and hardest stretch. Eventually, as he started to grow, they were able to back down off of the amount of sessions that he needed to have. So we were able to, the least amount that we were driving down there was 4 days a week. But it was anywhere from 4 to 6 days a week, depending on what he needed. Yeah. So yeah, 2 hours one way, depending on traffic, 2 hours the other way. It was about 4 to 4.5 hours of travel time and about 5 hours of actual clinic time.
And that would have taken place somewhere between 4 and 6 times a week.
Yes.
4 hours there and back, 4 hours on dialysis for a period of 4 times or 6 times every week.
Yes. Yeah.
Wow.
Yes. It was intense. It was. And it was tiresome for most of us. Kevin and I both got the experience of handling that and driving down there. There was a time where he was working, and so I would take him down. And then there was the time when I was working and he would take him down. But it was, okay, not everybody needs to see your loose tooth, your lost tooth there, buddy. But it was definitely probably one of the hardest stretches, just because Henry's body was getting tired. It's hard for a little to endure that much. And the hemodialysis really kind of, I feel like, is a little bit more intense for them. And we struggled with infections, and we struggled with, fluid management. And so sometimes, our day trips to dialysis clinic would turn into overnight trips or week-long trips because we would get admitted based on his numbers. And that was a reality of every time. We always had a bag packed, an overnight bag packed to take with us.
Okay. Now, I understand he was, don't worry, Henry, I lost a few teeth too. He was on dialysis until approximately his 4th birthday.
Mm-hmm.
All right.
Yep.
Can you tell us, Emily, in addition to some of the things that you've mentioned, what were the other challenges that you faced with Henry while he was on dialysis?
The big ones were infections. So there was a period of time in 2016, just prior to his bladder reconstructive surgery, that he contracted, I guess, or developed peritoneal fungal peritonitis. Sorry, words.
Okay.
And so he'd had peritonitis once in the past, and then it developed into fungal peritonitis, and he went through probably 3 different bouts of antibiotic. And so at that point in time, he was on PD, but every time he had to do a round of antibiotics, they would take him off and we would have to go down for clinic for hemo. So it was like hit and miss. We'd have, 3 to 4 weeks of PD at home. And then we would have 3 to 4 weeks of hemodialysis in clinic while we were doing this round of antibiotics. And the antibiotics were me taking these giant needles and syringes and drawing up these medications and injecting it into his PD bags. And I was like doing chemistry in his bedroom. And it was just wild. But yeah, we had about 3 rounds of antibiotics. And then they finally figured out that one of those shunts that was placed in utero did not come out during birth. It had stayed lodged in his body. And they had said at the very beginning that it wouldn't cause any damage. It would be fine. Something happened, something mutated, and that fungus just stuck to that shunt. And so while we were treating the fungal infection, because the source was still in there, it just kept repopulating and kept coming back. So eventually he had to have surgery to remove that. And then once they removed that the infections finally stopped. But that was hard. That was a big challenge. And then his bladder reconstructive surgery the surgery itself went well, but he developed a bleeding ulcer in the recovery process of that. And it was really scary. That was the point in time where, we were having conversations in the hospital with doctors that were just ending in, "I'm sorry." And that's a really horrible place to be, because you never give up hope as a parent and you never stop fighting as a parent. But when the people that you have put all of your trust in the world don't have a next step, it's terrifying. And so, I remember that week, that really bad week. Our poor families, they would get calls in the middle of the night that would say, you have to come down because we don't know if he's going to make it through the night. And then he would pull through. And then the next day he would be great. And then the next night he would tank again. And we did that for 3 or 4 days. And then there was a night that was really bad. And Kevin and I sat around his bed. Our whole family was there. We had our pastor come down at that point. And we were very much at a point where we didn't know what the next 6 hours were going to look like. And so we prayed with everything that we had. And we told him, we said, we knew he was tired, and we knew that his body was just exhausted. He'd had 3 emergency surgeries in a 2-week period, and just his little body couldn't take it anymore. And we told him, you have fought so hard and you have done so well. And if you are too tired to keep going, we understand, and it's okay. And God's got you, and you are going to go to a place where there is no pain at all. And he just, squeezed our hands as much as he could. And we squeezed his hand, and we left it to God. And the next morning his vitals picked up. And he stabled out through the night. And in the morning, he was 100% different, and we were at a point where we felt like we could breathe again. And so up to that point, that was the scariest part that we had. But we recovered from that, and we bounced back from that, and we were okay then, and things were kind of smooth until what turned out to be, thankfully, kind of towards the end of his dialysis process, I guess. About the end of year 3, we were having to have his port replaced pretty frequently. The lines were not staying. It kept coming out of the cuff. It kept dislodging, and we were running out of places to put it. We were getting to the point where we had about 1 more spot that we could put a dialysis catheter in. And beyond that, then it would just be up to God again. So there were definitely, looking back at it, there were definitely some scary times that, you know, we just thank God. We thank God so immensely at how it all turned out.
Wow. I read that Henry's been operated on over 30 times. Is that a fair statement?
It is. We're probably closer to the 40 mark at this point, 40, 45 maybe. But yes, he has had procedures and every single one of them has required anesthesia. So he has been intubated, you know, countless times. He has had finger sticks and heel sticks and head sticks and all kinds of sticks. And he's endured it. He's endured it all.
Okay. I understand that you and Kevin were working very hard trying to get Henry on the kidney transplant list.
Yeah. So the biggest issue was really his weight. And so he had to hit a certain weight marker in order for them to really say, okay, he's ready and he's eligible. And so then, you know, the search, once we made it onto the active transplant list, which happened, I believe in like early or mid 2017, somewhere in there. And there were a few times when Dr. Goggins would come down to clinic and he'd be looking, you know, and he'd come to the bed and he wouldn't say much, but he would come to the bed and he would just kind of look over Henry and he would say, you know, I don't think this one's going to work. And it was like, you know, we would always get so excited whenever he would walk into clinic because it was like, okay, somebody might get a kidney today. And so we had a couple of times of that, but because Henry was so small, you know, that kidney just would have to be perfect. And so yeah, we had a few times that we thought it was going to be the one, but we got passed over.
A few false alarms.
Yeah, a few, which is, it's a different type of disappointment. You know, you experience disappointment as an individual, you experience disappointment even as a parent. But when you're the parent of a medically fragile child, it's a different kind of disappointment. So you almost had to grieve a little bit. We had to mourn that loss a little bit. And so it was a little difficult, but each time, you know, we knew God would bring us the right kidney. And gosh, he sure did.
So let's talk about that a little bit.
Yeah.
I understand that Henry was able to find a donor, a living donor.
Yes, which is.
Did we lose you now?
Oh, I'm still here.
Okay, there you go.
There we go. Okay.
Henry was able to find a living donor, correct?
Yes, he was. And that is probably the most exciting thing about all of this. And it's why I love to share our story, because not only did he find a living donor, but our living donor was an adult. And so most of the time when I tell people that, they are like, oh, wait, what? An adult can donate to a child? Because everybody just kind of assumes that a child would need a child's organ. And that's not actually the case. So we just had to find the right adults. Mind you, you know, a 6 foot, 250 pound man was not a good not a good candidate.
Not a good fit.
No. And so we had been on the hunt. I had put a post out on social media. We had just a flood of responses. I was overwhelmed and just blown away by the amount of people that stepped up to the plate and said, you know, I'm going to go get tested. And, you know, there was a lot to sift through. You know, I was constantly telling people, you know, okay, well, these are the, basic prerequisites, you know, and so if you match these prerequisites, then yes, go ahead. I would encourage you to call and thank you, you know, but a lot of people didn't match those prerequisites. And so it kind of got whittled down. And then when we found someone who was willing to donate and get tested, and she made it all the way through, and she was a good initial match. But then we found out that her other kidney size, I'm probably going to hear Gertie here in a minute. Her other kidney size would have been too small on its own. And so she was not able to donate. And so we kind of felt that like gut wrenching loss again, because we were so close. But we endured for a little bit longer. And I put another post out. I had waited a little while, but I think it was probably about 6 or 7 months later when we were really getting to the point where it was clear that something needed to happen because we needed to do something different. And so I put another post out on social media, and maybe 2 weeks after I had done that, I got a message from a very dear friend of mine. And all it said was, I'm a match and I'm going to donate my kidney. And I was so just blown away because this person was my very first best friend. You know, we grew up together. We did everything together. We were inseparable. We had a secret, friendship club when we were younger. We were the type of friends in grade school that teachers almost didn't want us in the same class because they knew that if we were in the same class together, like nothing was going to get done. And we had graduated from high school, and just our lives had kind of gone different directions. And so we had kind of lost touch a little bit, but she reached out, and there was no hi, hello, how are you? It was just, hey, I'm a match, I'm an initial match. I'm going to go get tested because I want to give Henry my kidney. And from the moment that she sent the message, I knew. I felt something inside that I knew that this was going to be the one. And I was in the basement doing laundry actually when I got the message, and I just remember getting it and I just kind of fell to my knees because it was like, it was such a relief, and it was such a blessing from God that we felt we had hope again, and that there was maybe a light at the end of the tunnel. So, and she was, and it was great. And we went through, she went through the testing process, and 6 months later, she sent that message to me. I think it was either right before Christmas or right after Christmas. And then, so in July, on Henry's 4th birthday, he got his kidney from Colleen, and it went so well. The surgery went so well, and everything just did what it was supposed to. And both of our families were there and were gathered, and we were praying together, and we were fellowshipping together, and just spending the time in the lobby and checking on, Colleen, and Colleen's parents would come over and check on us. And the whole experience was just a little surreal. We all gathered in Henry's room. We had t-shirts made and we all gathered in Henry's room wearing our t-shirts and saying happy birthday to him because it was his birthday. And then our pastor led us in a rendition of Victory in Jesus, because that at the time was Henry's favorite song. And so one of my favorite video clips is just this entire room of adults and nurses and doctors just singing Victory to Jesus. And I still get kind of choked up about it because it was such a powerful moment, that there was so much God in that room that I just felt such a peace. And I still feel that sometimes. God does such powerful things, and he moves such big mountains that we got to see him move a mountain that day. And it was miraculous.
And this, just for the record, this is your friend, Colleen Collins?
Yes. Yep.
And so you knew her since kindergarten. You were best friends. You joined the Girl Scouts together. The first time you got grounded, you were with her.
Mm-hmm.
Okay. Yes. Uncle Jim does his homework.
Yeah, she really was. We even had our secret club. We called ourselves the Bash Sisters. And so we would kind of like go run around on the playground together and help people not be in trouble, I guess, from bullies. So
all those bad boys.
Yes. Yeah. So I keep seeing a question that pops up about where can we go to find information about pediatric kidney patients. And
my friend Candy.
Yes. So I love the AAKP website, but IU Health and Riley Children's Hospital, their nephrology department has so much information, and they are so knowledgeable about pediatric kidney disease. I know that Riley's nephrology and urology units are ranked among like the top 10 in the nation. And so I always encourage people, if you have questions, talk to the people at IU Health and at Riley, because they are so knowledgeable in what they do. So knowledgeable.
Candy, just so you know, the head of nephrology there is a friend of mine. His name is Dr. David Haynes, Haynes.
Mm-hmm.
The guy that did Henry's transplant, he also did my transplant, by the way, Dr. William Goggins. He's been on our show. We'll have him back again sometimes. He's the rock star of kidney transplant doc in our state. We call him Dr. 2000. He's done over 2,000 transplants.
Mm-hmm.
I don't know if who in the back, somebody's unhappy. So tell me, what were the challenges with Dr. Goggins transplanting? What kinds of problems did we discuss?
Yeah, sorry about the background noise. She's actually quite excited. That's her excited voice. Yeah. So the biggest challenge for Dr. G with Henry was kind of his real estate in his belly area, because he'd had so many surgeries. He had so much scar tissue, really finding a good spot for the new kidney to go, and then his size in general. And so that was just the biggest thing. And he knew that when he went in to do the surgery, that it was going to be a navigation process. And it was pretty tedious. I think we were in the OR for 8 or 9 hours. I can't even remember now. It was a long day. But that was the biggest obstacle, was really kind of getting in and navigating through all of that scar tissue and finding the best spot for that kidney.
Well, if Dr. G couldn't do it, nobody could do it.
Exactly. Yeah.
He's the best. I will say that. He is the best. I put a kidney page together for you guys for Henry, help find a kidney for Henry. And you changed the name of the kidney page after the transplant, The Marvelous Adventures of Henry and Mill, M-I-L. Can you explain what that symbolizes, what that's all about?
Yeah. So Mill is Henry's kidney's name. And we chose Mill because we have, from the time that Henry was really little, his dad has always called him Jimmy Miller, or we would call him Mill for short. And so we just kind of thought, it's a great nickname and it's fun. And, what if we now we call Henry Jimmy Miller and we call his kidney Mill. And so it was just, we knew we wanted him to have a name. And so we just gave him something fun that was an extension of what we called Henry when he was little. I'm not 100% sure where Jimmy Miller comes from. I think it was something from a movie that Kevin has always really liked. So he's always just called him that. But yeah, so it was just a fun play on a nickname that we called Henry for a long time.
Okay. I've read articles about Henry in the IU Health blog. Mm-hmm. I've read articles about Henry in USA Today. I've read articles about Henry in the Chicago Tribune. Mm-hmm. But the thing that always excites me is I understand that you were on the Today Show on NBC. Is that right?
Yes.
Tell us a little bit about that.
Yeah, that was probably one of the coolest experiences I'd ever had. So the media team at IU Health contacted me and said, hey, Good Morning America has caught wind of this, has caught wind of the story. They want to talk to you. And so they did. They came to the producers from the Megyn Kelly show, which is the Megyn Kelly portion of the Today Show, came and they did an interview. And we were in one of the parts of University Hospital, I think, over there. It wasn't actually at Riley. It was next door. They asked a bunch of questions and we got to share our story, and we got to talk about living donation and how real it is and how essential it is and how vital it is that, if you're willing and able, that you register to be an organ donor, because there's so many different ways that you can help. But yeah, it was a lot of fun. We got to share our story, the ups and downs, and we got to bring awareness on a platform that was pretty big. And that was probably one of the most important things, just because, you know, I still get questions. People still look at me in shock when I say that he has a kidney from an adult. So people don't think about kids having kidney disease, but it's real. And it's so important that people know, because if they know, then they can help in some way.
Okay. Talk to us a little bit about the challenges that Henry's been dealing with since the time of his transplant.
Yeah. So I will say medically, knock on wood, his recovery went well. We had, in true Henry fashion, he likes to throw curveballs. And so in true Henry fashion, about a week out from transplant, we had some weird kind of things happening, and didn't really know. I don't think anybody really knows still at this point what happened exactly. But things just weren't working the way that they were supposed to. But he recovered from that, and they were able to get it all kind of figured out. And since then, really his biggest struggle has just been catching up. When you have that many surgeries done on your abdominal region, there's no muscle retention or muscle tone there at all. And so getting him caught back up to where he needs to be physically and emotionally, just really is our biggest struggle now. And so we do a lot of therapies. We're involved in speech therapy and physical therapy and occupational therapy. And we also see another speech therapist for feeding issues. He was recently diagnosed with, it's called EOE. It's basically esophageal, I'm not going to get this right. I'm not even going to try it because I'm going to butcher it. But okay. Basically there's a gathering of cells kind of, and then it causes excessive inflammation of his esophagus. And so it makes it hard for him to swallow food. It kind of resembles GERD a little bit. And so he has trouble with, impacted food getting impacted, choking on food, swallowing food coming back up. And we don't know if it's being caused by diet, because he doesn't really eat very much anyway. We don't know if it's being caused by reactions with his medications, because there's science that show that transplant medications can cause EOE. We don't know if it's behavioral, if it's a trauma response, from being intubated. And so we it's brand new. And so we're just kind of starting to work through it and figure out what the best course of treatment is. We're going to start with a PPI, a protein pump inhibitor. And so, which of course, you probably understand the struggle with insurance. Insurance is battling us on wanting to pay for it because it's an over-the-counter medication. But of course, Henry can't swallow a pill. So it looks like, can we get a different form of it? Can we break open a capsule and sprinkle it over something? So it's a process. It's always a process to try to get a new medication. But those are the biggest things that we're really kind of struggling with. I just actually had a case conference with his teachers and the staff at school requesting an IEP, so that we could have some services done in school. And they actually told me that they would not pursue it because academically he is just on point. His test scores are all really good. He's doing well socially at school. And so we're battling all of those things on our own at home, outside of the school. Not that they're not supportive. They're wonderful. And we love his school. And they've offered to implement anything that his therapists ask. But at this point in time, we're just doing it outside of the school. So it's a wild world to try to navigate all of the different services. And I'm thankful for what I do as a profession, because had I not had my feet wet in that prior to all of this, I would probably feel like I was drowning. Because there's so much, it's making sure that all of his appointments are lined up and all of the medications and the feeding schedule. And so it's a lot. I mean, it's medical management, medical case management 101 basically. But those are really the things that he's battling since transplant. So But his kidney, gosh, his labs always look good. And at clinic, they're always so happy with how it looks. And it really is just doing what it's supposed to do.
Did you guys give his kidney a nickname?
Mill. Yeah.
No.
We
Okay.
just call him Mill.
I call mine Woody because all the men in my family, our middle names are Woodrow. So I named
nice.
the kidney after my dad.
Yes, that's awesome.
So have you been told whether or not Henry may need additional kidney transplants in the future? Can you talk about that a little bit?
Yes. So Dr. G did tell us that the shelf life for a pediatric kidney is typically about 10 to 12 years. Once they hit that puberty, their body just goes through so many changes that a lot of times the post-pubescent body and that kidney just don't mesh well. And so they start to see some signs of rejection usually after that. So he kind of prepped us for, maybe needing another one when he's a young adult or an older teenager, young adult, and then even possibly a third kidney transplant later on in life as well as an older adult. So he is looking at the possibility of needing 2 more kidneys in order to, for a lifespan of 60 to 70 years. But, you never know. You never know. When we were, okay, you're sweet. Thank you. When we were going through the process of all of this and people were reaching out, I would get messages from people that would say, my son has had his kidney for 30 years now. He got it when he was 10 years old and it's still going strong. And so we know, that God's in control and that kidney is going to work as long as God needs it to work. And when he does need another one, mine's being kind of kept on standby. So I'm a match. I'm a universal donor. I'm an O negative, and so I'm keeping myself healthy so that when he needs it, he can have mine. Okay.
You mentioned school. Talk to us about a little bit of the ins and outs with Henry and school. You've mentioned things in webinars with the AAKP about 504s and IET and stuff I don't understand. So could you explain what goes on with that when you're trying to put Henry in school?
Yeah, that's all definitely diving into the special needs world in the educational world, which I'm blessed to have a teacher as one of my moms, and she has been such an asset. She's been so helpful in navigating this process that I knew we were going to need to seek some special resources in school. And so he did. His first school experience was actually last year. He was able to do a year of pre-kindergarten, and he was blessed with a wonderful teacher at a wonderful school, and it really prepared him to do full day kindergarten this year. And so that's where we're at. He is a full day kindergartner here at Boyd Elementary, and he loves it. Last year when he went to school, he had an in-home health nurse that actually went with him. And so she was able to take care of all of his medical needs at school. It was a half day at that point. And so she was able to meet all of his medical needs. But we realized, at school, he's so independent that he just was adamant. He's like, I want to go to school by myself. I don't need somebody to go with me. And so we partnered with the school at the beginning of the year, and I just laid it all out. I said, this is what we need to be successful at school. Can you come alongside us and help us with this? And they were fantastic. The nurse that we have at our school is so helpful, and she's such a blessing. She's willing to do anything she needs to for Henry. And we've rearranged some things so that there's not so much hands-on stuff that they have to do at school. We handle all of his G-tube feeds here at home. He does still have a G-tube because of his feeding issues, and probably realistically will for the next couple of years. So we try to make it so that doesn't have to be touched while he's at school. But he has a urine collection system that he wears instead of voiding, out through his urethra. And she's very helpful with that. Whenever Henry has trouble, opening and closing it, she's very helpful with that. And I had hoped to get some extra services for Henry in school. But in order to do that, you have to have either an IEP or a 504 plan. The 504 is just kind of the medical version. It's kind of like saying, okay, this child academically, he doesn't have a learning disability, but he does have a health impairment that has caused a delay in development. But they felt that he doesn't have enough of a delay at this point, I guess. And that academically he's performing too well in order to pursue special needs services at this point in time. Not that he might not need them in the future, but where he's at right now is on point enough that they're going to just let it right out. So,
Okay.
Yeah.
Talk to us a little bit about how your family and the school is dealing with COVID issues, COVID-19, in the age of Cyrus the virus and Henry.
We thought when we went to our clinic appointment prior to school starting last summer, or earlier in the summer, we were really expecting to hear, go with virtual learning. You need to do learning at home. And I got to give it to Riley and IU Health. They did their research and they really looked at the numbers and they said, we're seeing kids with kidney patients get COVID, but we're also seeing kids with kidney patients recover from COVID really easily. Maybe not easily, but they weren't quite as overburdened by it as what I think everybody was expecting. And so they encouraged us to do school in person. And he was so excited. I remember telling him the day that we went, I was like, buddy, guess what? You're going to get to go to school. And he was like, what? Can I ride the bus? And I said, do you want to ride the bus? And he said, yeah. And I said, can you ride the bus? And they said, sure. And I said, okay. So he just dove right in. We've done the e-learning days. If he's sick or if he has a cough or anything like that, we stay home. But he has been healthy, knock on wood, and has been able to be at school when it's been open. So we're kind of curious to see how the rest of the year is going to go. The middle schools now in our district are doing e-learning only for the rest of the semester. So, we'll see. It's all different. I know our school and our district in particular, masks are part of the dress code this year. So, it's a mask all the time when he's at school. They started off the year doing lunch in the lunchroom at specific tables. And now I think they're kind of morphing it to where they're eating lunch maybe in their classrooms a little bit. But his school has done a fantastic job of just staying on top of it. They ask teachers to quarantine or kids to quarantine if they've been exposed even. And so it's really kept the amount of positive cases that we have seen in our school to a low amount, which has been fantastic, really fantastic.
Okay. I noticed that advocacy, particularly for pediatric kidney patients, is important to you. Can you tell us why and some of the things you've done as an advocate?
Yeah, well, I love working with kids, and it's always been a passion of mine. And I think because just kids in general, they're our future, and they sometimes can't advocate for themselves. And so I have always had a passion for speaking on behalf or for people who cannot speak for themselves. And there's a lot, I've learned a lot about kidney disease, and you probably know this from your experience, that it's not an outward disease. It's very much an inward disease. And so when Henry was on dialysis, it was a lot of just observation of his body, because he couldn't always tell us, I don't feel good, or I have a headache, or, things that we would notice as adults of signs of our fluids being off or maybe something not working. Kids don't know that. And so for me, it was just constantly observing him and getting used to his body signs and his body language. And so there was more than one occasion when I would have to grab one of our nurses and say, hey, we need to turn this machine off or back it down or slow it down or something, because, you know, his eyes are sinking in, he's getting lethargic, he's getting tired, he doesn't want to talk as much. You know, he's laying his head down. And those are all things that he couldn't tell me. And so it just really made me kind of wake up to the fact that our kids need us to speak out for them. And not only do they need us to speak out for them, but they need us to act on their behalf and to make sure that we are paving a way for them to have clear futures. And especially with pediatric kidney disease, there are so many. I know that the Riley Clinic is overflowing right now with kids who are hooked up to machines, and they've had to add clinic days and they've had to add beds. And you know, I know that kind of kidney surgeries kind of got put on the back burner. Transplant surgeries kind of got put on the back burner for a hot second with COVID. But it's so important that people know that it's real. It happens. Kidney disease is not something that just affects adults. And that there is a hope. You know, kidney disease, there's no cure for it. But a transplant is the best treatment available, and it's an option for kids. And I think that that's the biggest thing that people get hung up on sometimes, is I think they think that transplant isn't an option for kids, or it's not as likely for kids because, you know, the organ would have to come from another child, and that's just not the case. And so just making people aware of that, of, you know, hey, you've got two and you only need one, so share your spare. Because it could even, you know, it could go to a child. And there are so many different avenues of donation, living donation now. There, you know, you can do a kidney swap where you can, you know, agree to give it to somebody else. You can give it to a total stranger. You know, it doesn't necessarily have to be the direct, you know, where Colleen did, where she signed up to be our donor. There's just so many different avenues. And so just letting people know that that is out there, especially with kidney disease, you know, it's there and it's available. And I think making people aware of it just opens up the doors, and it opens up the opportunities for more kids to get transplants.
Excellent. Is there anything today that you would like to talk to us about that I didn't ask you about? Is there anything that you would like to add? Did I miss anything?
I don't think so. Oh my goodness. It's just been such an honor to talk about our story. You know, our family mantra is kind of turn your test into your testimony, and what a testimony it is. And it's, you know, Henry has been such a teacher, and he has been such a motivator. And the one thing I guess I would say is, there is hope. There is always hope. And there is a hope that, you know, I didn't always necessarily truly believe in. I've always believed in God, but my personal faith was not as strong, you know, as it is now. And Henry introduced me to that. Because when you get to a point where as a parent, you have no one else to lean on but God is there. God's always there. And so I would encourage anybody out there who is struggling with not having any hope, reach out and reach up and throw his name out there, because Jesus is the most powerful name in the world, and there is not anything that can stand against him. And so that is 100%, you know, who we give credit for Henry being here today. And I feel like God has given me the power to use my voice. And if there's one thing I can say to kidney parents out there today, or parents, any caregivers caring for a pediatric patient, use your voice as a parent. Because while we are surrounded by experts in our medical fields, as parents, you are the expert of your child. And while one thing might work for one patient, I'm always a believer in trial and error. But you have to be willing to use your voice for your child, and just stand up and know that you're never alone. There's always someone who's available to answer questions. I'm available. I'm involved in a couple of different Facebook pages and run the Marvelous Adventures of Henry and Mill Facebook page. And this is
Parents of kidney kids?
Parents of Kidney Kids, yes, is one of the biggest groups that I'm involved in. And, it's just a wonderful resource to be able to go and post a question. I've done that before where I've felt like I've tried everything and nothing is working to get them to eat. And I go to the page and I post my issue, and within a half an hour, I have people from all over the world commenting and saying, yeah, we've experienced this too. Because you get to a point in this journey where it can be very isolating and you feel like you're the only one walking through it. But then you take a step back and you realize, no, there are so many people that are actually experiencing this and walking this journey. And there are so many people that struggle with something else. And so, I hope that my words and my testimony make somebody else feel like they're not alone in it. So I'm always an advocate for self-care. And I feel like part of that is not isolating and reaching out and being a part of something that can just restore and refuel you as a caregiver, because it's an intense job.
Well, Emily, I thank you so much for taking time to talk with us tonight, my friend. And I thank you for the webinars you've done with me and for me for the American Association of Kidney Patients. Please check Emily out. And I appreciate you taking time. That's
Thank you,
our show
Jim.
for tonight. Oh, you're welcome. No problem. I'm just really happy you could do this.
Yes, I love it. I love sharing it and love getting to talk with you. So
thank you. Next week, Dr. Holly Kramer is back with us from the NKF. She's bringing the head dietitian of the NKF with her and an independent dietitian, and we're going to have breaking news about nutrition and Medicare and getting you a dietitian. So you don't want to miss that show. Until then, this is your Uncle Jim. Peace and love, everybody.